Hi, this is Dr. Mercola helping you take control of your health. And today we're going to talk about chiropractic, but not any just type of chiropractic, a specific type that I think you might be particularly interested in. I want to give you a backstory on this. A good friend of mine, Dr. Peter Martoni, who's been a chiropractor for many years, pointed out to me about a year and a half ago now that he thought I had some problems with my cervical spine, and was provided such a compelling story that I flew up to Boston to visit him, and he took some x-rays, and sure enough, he was right. I had degeneration in my fifth and sixth cervical vertebrae, even though, and here's the key point, folks, I had no symptoms at all, but my pictures did not look really good. So the type of treatment that addresses that is, which we're going to talk about today, is this very specific type of chiropractic care. And we'll expand on the details in a bit, but I want to introduce you to Dr. Michael Hill, who is a chiropractic physician. He lives very close to me, and I've been getting care from him for the last 3 months, and I'm going to show you some pretty dramatic examples of what it's done. So welcome today, and thank you for joining us, Dr. Hill.
Thank you, Doc. Appreciate it. Glad to be here.
Yeah, it's really, I'm glad to have you. So um, let me give a little more backstory to sort of frame it so that you can start discussing what the differences are, because there's a lot of misconceptions about chiropractic, and I'd like to have you help clear some of them up here today, because there's a whole wide variety of clinicians. And I had previously thought that taking an x-ray of the spine, because I'm trained as an osteopathic physician, so adjustments and manipulation are not foreign to me in any way, shape, or form. I did them a lot in my practice, but we were never taught in all our training that the type of therapy that you've been providing me, which is very specific, very precise, and measured accurately with an x-ray, so you can guide your specific treatments. So I had always been opposed to x-rays. I don't think they were necessary, but now I'm convinced that I think it's almost malpractice if you are seeking a long-term care program and you don't have these. So the type of care that you're using is called chiropractic biophysics and Gonstead. So why don't you discuss those and maybe the broader
Sure.
range of options that a typical person would find in their local chiropractor?
Yeah. So one of the first things I always like to address is where the patient is coming from. When asking them, what is your interpretations, your experience with chiropractic? I hear a variety of different answers. And one of them are very good, and some are, very far from what chiropractic truly is. And I graduated from Palmer College in Davenport, Iowa, where that was the fountainhead of chiropractic. So,
And let me just stop you there. And that would really impress me when you told me that, because unless you live in Florida, you wouldn't know this. But Palmer, the one you went to in Davenport, Iowa, which is significantly far from Florida, because you're a Florida resident. You were born here, and there is a Palmer Associate College that's not too far from where you live, and you could have commuted there, but you didn't. You chose. So why don't you expand on the reason why you chose that? Because I was impressed with that decision.
Right. Well, my chiropractor growing up, I've been under chiropractic care since I was 9. So really, it just fell onto my heart and hands, knowing that with the experience of chiropractic that I had and the benefits that I had received, once I realized what I wanted to do, I went off to college to North Florida. I wanted to kind of migrate north as slowly as possible, knowing I was going to make that big jump. And my chiropractor was actually a graduate of Palmer, Davenport, Iowa. And so I went to North Florida, got a degree in nutrition and dietetics, and then made that big leap to Davenport, Iowa for 4 years, where that's actually where I met my wife, which is a chiropractor here in the office too. And then I told her, I said, if we're going to take this serious, I am moving back home. But how that may have worked or not. I did convince her to move to Florida with me, and that was in 2004 when we did that. And we had those 4 hurricanes come through, and I think we were just close to packing up with the peer pressure we had from her family. But she's from Wisconsin, and it was just one of those things
She's a farm girl.
She is born and raised on a farm, 160-acre vegetable farm. But what a humble life, and just amazing family. And so when we moved back to Florida, I really want to give back to the community that I grew up in. And so We have, and it's been a blessing. Got two beautiful kids, and to take care of our community is amazing. At the same time, I didn't realize the discrimination that our profession had, and fighting and helping to clarify what we really do. And I think that's the thing. Education is inoculation for disruption. If we're not willing to be educated, then we just really stay in this disruptive mindset of not understanding what our profession is, but in a whole, how we can all work together as a team in all professions when it comes to your healthcare. And so with chiropractic, one of the big components that I like to really help patients to move them from understanding that not in all cases do you have to fill that cabinet up in your bathroom, but help to understand where all health and healing comes from. And that's obviously, we can't deny that, or that the nervous system obviously coordinates all function and healing in the body. And if we don't know how to take care of it, who's going to do that for you and help you understand the importance behind it? So education is one of our biggest components in our office. Now with the technique, chiropractic stands on three legs: the philosophy, science, and art. And so when we take those three legs, and if we take one away, it's obviously easy to tip from. So we got to stay in solid on those three components. And with the science, understanding CBP and Gonstead technique, it's one of those approaches that really takes.
Sorry for interrupting, but CBP is chiropractic biophysics.
That's correct.
Yeah.
Yep. And the training that I had received was actually not through CBP's seminar series, but over 7 years with an organization that taught the specific adjusting protocols with CBP.
So this is a postgraduate educational course that you took after graduating in Davenport.
Yes, through an association. Yep, chiropractic association.
Okay.
And then Gonstead is a technique that is taught to students throughout the curriculum. And you might hear like the Palmer package, but typically there is a package of techniques that every student is taught. And it really, I think, falls on the philosophy of the chiropractor. And in my situation, my chiropractor was utilizing Gonstead. So whenever I showed up at Palmer and I wanted to learn more about the technique, I realized there was a lot more than just Gonstead out there. And Gonstead and CBP have a lot in similarities, but a lot in differences. When it comes to understanding structure dictates function, and your spine is basically the framework of everything else that works off of that, then it's important to understand that we need to identify any structural changes that are compromising the way we should function. And the intimate relationship between spine and nervous system is just that. It's that intimate, in which if we don't take care of the spine, obviously the next is going to fall short of expecting 100% function and health and healing. And that's through proper nerve function supply.
Well, thank you for sharing that. And I've had, obviously, as an osteopathic physician, an awareness of these principles, and have many good friends who are chiropractic physicians. Yet somehow the integration or the motivation to apply this on a regular basis wasn't sufficient enough. And even though I didn't have pain, I finally became convinced. I'm so glad I did. And one of my biggest regrets is not doing it sooner. So I think maybe if you could reemphasize the structure function component and how the nervous system is seriously influenced. And, the assumption is if you're not having pain, that probably everything's okay. But, the reality is, and it's certainly true for medical diseases, and I don't have the experience you do in treating musculoskeletal diseases, but most of the time you're 80% of the way there before you have a symptom.
That's just it. Research states that you have to have lost 40% or greater of your health potential before there's a sign or symptom that actually is expressed. I mean, when my father had a heart attack, I didn't need to ask him, why did you put us here in the middle of the Ocala National Forest? Instead, just like any disease, it takes time for that manifestation into a symptom. And so it's unfortunate that we are taught to treat and manage a disease as opposed to preventing them. If we prevented it, we actually wouldn't be even having a conversation about it. So being more proactive instead of reactive is the approach that I would rather have my family, and I'd rather have patients that entrust in us to help them move in that direction. But yet we're born into a society where it's treating and managing a disease.
And of course, one of the primary tools we use on our site is to help people understand how to choose the right food so that metabolically they'll maintain their health, which of course integrates very tightly to structural function. But I wonder if you could expand, because we don't really talk a lot about the structure function relationship,
Hmm.
but it's clearly there.
Hmm.
And if your spine is out of alignment,
Hmm.
and maybe you can give us an estimate as from your experience what the percentage of the population that you see is, and I'm sure it represents a pretty common thread through most other populations. So, how many people are out of alignment, and what are the consequences of that you see, and some of the things that you can prevent?
Sure. Palmer just did a Gallup poll, and basically, the last report that I had read um, had shown anywhere from 8 to 12% of the population utilizes chiropractic. Whereas if you use that into, let's say, dentistry, I hope everybody's taking care of that. My dentist said actually brush the teeth you only want to keep, right?
Hmm.
So when I translate that into chiropractic and spinal hygiene, I would only expect that 100% of the population is utilizing some form of chiropractic care. And so structure detaining function, understanding that the spine has to be straight from front to back, and that from the side views, these curves are actually developed that we notice from the side view through the crawling phase, which involves other reflexes like the cross crawl reflex during that developmental period. And so it's really important to understand the certain standard of deviations, like having a 45-degree curve is what's considered normal. And that's, for instance, in the neck, that's called lordosis, right? And so when you have a decrease in that curve, you have hypolordotic curvature. And if there's an increase in that curvature, you have hyper lordotic curvature. So knowing that there is a perfect normal to go from either extreme to less extreme, it's important to identify that. The reason behind that is because we've understood that when structure is sound, like for instance, having that 45 degrees in the neck, the cord that travels through the spine is at its best position to allow that communication from above down and across out to every organ and tissue and back up to the brain to send the signals through what's called an afferent efferent message or pathway. So when we look at structure not being in its proper place, like a malposition that chiropractors are only trained to identify, then utilizing certain tools at our advantage to be able to help us understand how we can help the patient and help them understand where we need to go from there. And so, for instance, we use a surface EMG tool that basically allows us to monitor muscle balances and even thermography, which allows us to even see on a neurological side, we can see things in a little more in depth than just using. So, for instance, I'm big in instrumentation, and one of the big tools with Gonstead is a nervoscope. And Gonstead uses 5 parameters: uh, x rays, instrumentation, motion and static palpation, and visualization. Really important. As you can probably see now, that if you were in line at a grocery store and one person had a high right shoulder or a high left shoulder, you obviously know there's something wrong structurally. And if the spine is the framework, then we obviously need to address the framework. So visualization is really important as well. So when we put those techniques in place and the tools that we have available, such as digital x-rays, then we can analyze those x-rays using the CBP line analysis approach and the Gunstead. I like to merge the two. I really feel like we can cover everything utilizing those two techniques as far as not just getting a patient to feel better, but get them to function better. And if they're
Hmm.
functioning better, this could translate into being able to play with your kids, to looking at what 10, 20 years down the road looks like. And if anyone's ever been goal oriented, you know that once you reach it, you don't just stop the habits that allowed you to get there. And that's where and I've always, like I said, I've always been under chiropractic care. And it's something that I would wish and hope that everyone that comes at our office and it goes to any chiropractor, and hopefully they're educating them that chiropractic care isn't just a season in life. It is part of life.
Yeah, yeah, that's a good point. And part of the reasons you'd want to continue in care is that the compression that occurs on the nerves exiting the spinal cord from malaligned vertebrae can really cause some problems, specifically on the autonomic nervous system. I'm sure many people have heard of that, but especially in the cervical area, if you have some compression there, then you can definitely have some consequences as a result of that. So maybe you can expand on that, and then we'll talk a little bit about the X-rays.
Yeah, sure. So whenever you have a malposition of a, I'll just use this model here, for example. If you have two vertebrae right here that are protecting, obviously, the nervous system, and you have discs, which are in between those two vertebrae, when you have proper alignment, you have the ability to hydrate that disc. That's called imbibition, or the ability to imbibate or hydrate that disc. When you lose the proper position of the spine, you lose the ability to hydrate or imbibate the disc. So what tends to happen is the space in between the two vertebrae diminish. And as they diminish, the space that is, where does the disc go? It has to migrate somewhere. And what happens is the disc then tends to bulge out over time, not age, because here's the step processes and how spine can even degenerate. And so as the disc is actually attached to each one of these vertebrae, called Sharpie fibers. These fibers, over time, Wolff's law of theory, right? Over time, what happens is it changes the shape of the bone. No different than no one's ever born with a heel spur, but yet if we know that the dynamics of the foot and the arch that's dropped changes the tension on the tendons or the ligaments, then obviously we're putting stress on the attachment. And so when it comes to the spine and the disc, as that bulge occurs, we actually change the shape of the bone, causing bone spurs. And those bone spurs are obviously a result of not self-neglect, but neglect and not knowing what you should have known, and someone had a chance to educate you. So that obviously forms many different things, such as the fibers that help to define the disc, that the annular fibers that are obviously disrupted, the integrity of them are also weakened, and that's where herniations can come into place. So in light of not only a misalignment causing nerve pressure, but the soft tissue around there, such as the disc, can do the same as well. So again, understanding that we can address the cause by correcting the misalignment will allow us to be able to imbibate or hydrate that disc. We can actually help to restore to a certain point, depending on the limitation of the matter or the condition of the bone. We're obviously not going to be able to eliminate what's already been destroyed, or actually this is the body's ability to heal and stabilize. So it's a healing component. It's just who wants to heal like this.
Right. Absolutely. So, and in fact, that is precisely what happened to my lower cervical spines and vertebrae and disc spaces, that they were degenerating, and I had degenerative disease in my fifth and sixth cervical vertebrae, which is actually reversing now, even after a short 3 months of therapy. Now, in the past, I had been reluctant to get regular treatments because it would seem, mechanically, it just didn't seem to make sense. That a little adjustment here is going to make a massive difference. But the issue is that it really needs to be done on a regular basis. But not only that, and this is what I really liked about your program, is that it's integrated with home therapy. And it always never made sense to me to rely on a chiropractor to adjust you periodically to solve the problem. I mean, you've got to address something at home on a regular exercise program, and that's what you did. And actually, I'm going to you showed your spine, so I'm going to show my little toys here. And you from an evaluation of the lateral curvature, you provided me with one of these head devices that you just put on your head, and it's got weights. Now I have about 4 of these 1-pound weights here that are attached to this like a headband, and then you put it on. In my case, I put it on the right side, and I just wear this for like a half hour a day, and that helps some compensatory changes going on. But the one I really like is this traction unit that you hang up on your door, and this goes on your forehead. Actually, this goes, let me see. Nope, this goes behind, and then this goes up here.
Nope.
And I got it reversed. Okay.
You got it reversed.
All right, there we go.
There you go.
All right, there we go. I do it every day, but you wouldn't know it. So and this is hung up there, and then you just put your body weight to put traction on your cervical spine, and it's made a tremendous difference. Again, I didn't have any pain, but the X-rays are the key, and that's what I want to talk about now. As I said, I don't think it's I think it's really close borders on malpractice not to do x-rays. And we're saying x-rays, we're talking about digital x-rays, because digital x-rays are going to reduce the radiation exposure by 90%. And that's a whole other topic of discussion we're not going to go into here, and how you can remediate against some of that ionizing radiation by metabolically. But you can. But if you're getting digital x-rays, it's not as much of an issue. So why don't you talk about the x-ray component and how you can see these changes and the rapidity of which they can change, because that was the other thing on our initial consultation. You showed me and my girlfriend Erin, who's also in care at your office, and some pretty dramatic examples of patients you had previously treated, where the cervical curve should have been 45 degrees, which is the optimal normal that you mentioned earlier, and women specifically were coming in with like flat cervical straight like 0 degree curves, like Erin has. And then these women, the women that specifically pointed out and showed the pre and post, is that she had really severe migraines, and they disappeared once you were able to put some more curvature back in her spine. So maybe you
Right.
can elaborate on that.
Yeah. So when we take the X-rays, there's three that we take of the neck, and there's two of the mid back and two of the lower back. Obviously, you want to take an A to P and a lateral, so a front and a side view, so you have that two-dimensional approach. And so with the align analysis that we use, we can determine exactly the curvature of the spine from the side view, and if there is any scoliosis of the spine, we use an analysis called Cobb's angle to determine and help to manage and improve the degree of scoliosis on those that have scoliosis. So when we
Which is a lateral curvature of the thoracic spine, right?
yeah, it can encompass the lower back.
Okay, but typically thoracic.
Yes, most commonly. And so when we analyze these X-rays, we take all views in consideration. And I know you had made note that for your head weight, we just use the lateral, but we actually use the A to P as well, because if there's a lateral deviation from the A to P view, then we know exactly what side to put the weight on. And CBP uses like a mirrored image exercise as well, and that's what we're doing with you. So like you said before, thank goodness we're doing home exercises, because the environment you came from is actually the environment that created the problem. So even the structural changes that we make in workplaces and other organizations that we've been able to be a part of, it's allowing us to get in there and help people improve not only their work ergonomics, but the ability to be able to sit down for prolonged periods or what have you, or play golf or whatever it is that you do for a living. But yeah, it's really important to understand where you start and where you're at, so that we can always change the sail if the wind changes direction, to know that we're still going to hit our target. And for you, just like any other person, we don't want to say you're going to get the 45-degree angle curvature back in the neck, for instance, because of the damage that's already there. We're going to do our best to make sure that you can not go further south and improve the curve from where you started. And that's what we've been able to see even with you and thousands of patients that we've been able to take care of for years.
Yeah. And, I tend to be relatively conservative and short on time. So when I saw Peter in Boston, he had recommended getting care, and I said, well, let's see what some conservative things would do. So I was standing up and not sitting down anymore, and had integrated his sleeping position. We'll put a link to the video here in our article, so people can see that if they haven't already. Where essentially, I think you agree with this. The ideal sleeping position from his perspective is to lay flat, but then to support your cervical area. So I had done that for 6 months, and then we did a follow-up X-ray, and the degeneration of my cervical spine actually worsened. Which, like, okay, now I got to get serious about this, because I know inevitably that there are going to be serious consequences from that.
Yeah.
So and maybe at this point we can look at the X-rays. My initial X-rays. Do you have a set there that we can put a copy up on the screen?
And you hit nail on the head on something that it's not just one ingredient that makes up a recipe,
Hmm.
and that doing one thing. I have patients that say, well, health comes from what you eat or how you exercise. And I think that's a great component. But if you don't have your health, you're not, those things won't assimilate properly. So,
Yeah, and I was also it did what I neglected to mention. I was doing photobiomodulation on my neck. We had a pretty high-powered machine and doing near infrared saunas and doing some exercises that I thought would help, but it didn't work. I mean, I really needed a very specific, precisely targeted and customized prescription for my neck.
yes.
And I'm very grateful because it's been enormously. I can see the progress. So subjectively, I haven't seen any changes, although I might have noticed a bit in my heart rate variability, which I'm impressed with. I'm doing a lot of things, but it's definitely improved. And that is
Mm-hmm.
one thing you would expect because heart rate variability is a function of your autonomic nervous system
Mm-hmm.
primarily. And this is what you'd expect if you have improved cervical function. So can you describe some of the X-ray changes you're seeing? Because we're going to throw up a graphic of the image so that people can see my pre and post. Okay, so on your screen, you can see my initial X-ray on the first consultation with Dr. Hill. And can you describe some of these angles? And the 5 and 6 there you see are my fifth and sixth cervical vertebrae. But unless you have a lot of familiarity with it, it looks like some bones, but it's
Mm-hmm.
difficult to understand it. So why don't you walk us through that and show where I was at the beginning?
Sure, absolutely. One of the key things that I want to point out is the palate line, which is the roof of the mouth. We want to keep that as level as possible so that pre and post X-rays we're going to have very little uh, error there as well in evaluation. So typically, what we'll do is we'll drop a line down from the back of C2, which is
Right
the
up here.
long line that you see there, extending on down through the tracheal shadow. And then we'll also, and this is the backside of the vertebrae, which also you can follow the backside of the vertebrae, which is called a George's line.
Mhm.
So we're doing that right there at the back of C7 as well. And then we compute our angulization, which we get a 27-degree curve here.
Mhm. And
And
again,
most of the,
ideally, it should be 45, and I was
yeah,
27. This isn't terrible, but
exactly.
it's not great.
Exactly. And most of your curve makeup is right in between the C3, C4. And
Yeah.
that also explains why C5, C6, which is, I also want to point out, it's a common area, but we don't want to use that as well, it's common or it's normal. And a lot of people
Hmm.
are told it's normal because of your age, or it's C5, C6 is normal to degenerate, but it's not. It's actually common and it's not normal, if that makes sense.
Hmm.
I know it's a play on words, but we get so many times where people are explained that it's because of age relationship, where at C5, C6, if that's age relationship, then why isn't every other disc space degenerating at the same rate
And these
C5
are
and
the disc
C6?
spaces. Now, these black or darkened spaces between the vertebrae, you can see
Yes.
this is like almost a normal disc size. And then when you get to the fifth one, it's like squashed, and the sixth one is also squashed.
And that's why the shape of
Not
the
good.
vertebrae are
And
actually changing
yeah,
because of
you
the
can see the
attachment of the Sharpie fibers.
which is the lipping right here, which is a sign of degenerative changes. You
That's
know,
correct.
and even though I had no symptoms, I mean, my cervical spine was going to hell.
And there's no one that once we take the x-rays that I would ever ask to say, why did you allow this to happen? Because like you said, there's never truly any symptoms leading up to the point where what we found the condition of your spine.
Hmm.
So now right below is the C2 angle, which you want to be anywhere from
This angle
0
right
to
here.
10 degrees. So
Yeah,
you were within the normal limits there.
yeah. So that was good.
Yes.
Okay, so and again, it is easy for an uncharacter or a chiropractic physician with not much principles to cheat on this by changing the jaw angle here. So this just
Absolutely.
keeps you honest.
Absolutely. And also, if you went down to C3, you'll see the malposition or the extension position right there at the corner where your cursor's at, how that's sitting back. If you were to follow George's line,
Hmm.
that's actually extended back beyond the C4
Hmm. Oh yeah,
vertebral
right down
George's
here. Yeah,
line.
it is. Yeah. So ideally, it should sit more flatly in this curve, but so it's bent there unnecessarily.
Absolutely. Like you see C4, C5, if you follow the back edge of the
Hmm.
vertebrae, they
Yeah,
should all line up.
but this one's not.
Exactly.
Okay.
And that's what would be considered like a disruption of George's line.
Okay, so this is what you started with. This is my current one. And you can see a big difference. So actually, what
The extent, yeah, the extension view of C3, the George's line, is much better, and
right
the
here.
degree is obviously much better. The ideal is 45. Your
And I was at
C2 angle is
27, and
0.
we're up, yeah, zero. Is zero the best,
Any
or it
Anywhere
doesn't
between 0
matter?
and 10 degrees.
Okay, so it doesn't matter if it's zero or if it's eight. It's pretty similar.
Correct.
Okay, so and I got up to 34, which is an improvement of 6 degrees in the angulation of the spine. But I don't know if it was measured on the last one, but the disc space increased considerably. And you may even notice the difference here, how it looks bigger, hydrated, it got fluffier. Now the degenerative changes are still there, but it's an improvement, a pretty radical improvement
Hmm.
for a few months.
Yeah, and that's the ability of resorption. And I figured, the words in the dictionary and understanding the physiology of the body, resorption is the ability to rehydrate, in this case, the discs.
Hmm.
And that's through the action of imbibition. And so once we can help create a better structure, the ability to imbibate or hydrate that disc and be able to move is going to be able to help that as well.
You've made a pretty compelling argument for everyone to be in chiropractic care, and I would have to agree with that. It's better be proactive. I mean, if you're absolutely have no system, even if you had like a perfect structure, which virtually no one does, um, you would benefit from, especially if you're in competitive athletics. I mean, it's crazy. I mean, it for an athlete, it's going to give you an unfair advantage almost, because you're going to be functioning at a higher level. And you find many professional athletes are under chiropractic care, and probably a higher percentage than the normal population, I would think. What's your experience? And one of your sports is golfing, and you treat a lot of professional golfers in your office because there's a lot of golfers in Florida.
Yeah, yeah, absolutely.
So why don't you tell us your experience with athletes?
Well, like I tell them, is if you are even 1 degree off from your goal, that can make a big difference in your paycheck, for them. And I really want everyone to understand that, the degrees of change that you made for some may not seem significant. And I always ask them, if that's the case, the difference between 211 degrees of water and 212 is boiling water. That 1 degree, and yet that boiling water makes steam, and steam is what drives a locomotive. So honestly, if we can and look at the fact that the degrees of change that you've made in such a short period of time, and for even the professional athletes that we take care of, and that can even be the moms, is that the quality of life is huge and important. I think that's the side effect of chiropractic. Is pain relief is just a secondary component to correcting a structural change in someone and in their health. For instance, the nerves in the neck travel down the arm, forearm, and hands, where those same nerves go to organs and so forth, communicating between the parasympathetics and the sympathetics to help with that heart rate variability that you talked about earlier. So it makes a huge physiological change in everyone's life. For our athletes, I did mixed martial arts through the 90s and all the way up into the 2000s. And I knew that if I didn't have my ability to have the flexibility, I was going to get tapped out. So I was always under chiropractic care. That didn't just allow me to have the flexibility, but I knew that every joint in my body was moving and articulating the way it was designed to. So for those, like, for instance, that have spinal degeneration, like in your neck, like many others, one of the chief complaints that you hear and one of the measurements that we take in consideration is the loss of range of motion.
Mm-hmm.
You're going to have a change in range of motion with this type of spinal degeneration, depending on the severity as well. So you also create scar tissue in there, which a lot of times it's called crepitus. So it's like a frozen shoulder. Sometimes we got to get in there, and over repetition, we got to break it up. And so it's been a huge change for, for myself, for the athletes, for the patients that we've been able to see, and even the changes that you've seen on our website. A lot of those pictures are on there to show you the pre and post.
Sure, we can
And
put a link to that. So I want you to address now the elephant in the room, because obviously it's a relatively small percentage of population under chiropractic care. And probably some of that is related to a bad reputation that the profession has had from some unscrupulous characters that aren't practicing the type of care that you are, and others. No, I don't. So there's a certain segment that you want to avoid. So why don't you talk about that, and then we'll help people identify or the process of how to find someone like you
sure.
locally,
So
because and it needs to be locally. You're not going to be flying in to see Dr. Hill. I mean, you could, but you need to be seen initially 3 times a week and then twice a week, and that's you got to find someone good locally, which is why Dr. Martoni found you for me, and I'm so grateful for him for doing that.
absolutely. And that's the big thing is when we have patients that say, well, my aunt needs care. And I go, well, where's your aunt live? In Nashville. Okay, let's do our best, because this isn't about me. This is about your
Mm-hmm.
aunt getting the care that she needs and the trust in someone that we can put her in the hands of, like Doc did for you. And so, definitely thank him for that. Yeah. So going back to your original question, how do you find someone?
Mm-hmm.
Well, what I always ask is that if a patient even comes from another chiropractor, I always like to make sure that we're moving our profession forward by not talking badly about one. So I always just say that, um, whatever they did, it was not wrong or incorrect, but what we have to offer is exactly what you need, so that they know that they're in the right place. For me, the type of care I'd want for my family is the type of care that I was taught at Palmer College. And one of them is that the utilization of x-rays and all other components of our initial examination are very important. But if we look at x-rays, we look at x-rays like a contractor or any subcontractor would look at blueprints. Without those blueprints, where would we know where to lay the plumbing and electrical? And when it comes to your health, which is much more important than that, your x-rays tell us a big story. For instance, when we talk about your lower back, in many cases, if we'd have just taken one view, like an A to P, we'd have never seen the two-dimensional viewpoints of the lower back to understand, was there a translation of L4 or L5 that would not be an area that would actually motion out well. Without x-rays, why would we want to be adjusting in that area if there was what's considered like a grade 1 through 4 spondylolisthesis, which is a slippage of a vertebrae on top of the other, which is a disruption of the George's line, even in the lower back. So, x-rays are, and all those details to the examination are super important. And if patients aren't getting that, I would be concerned. No different than I was telling you the other day that, if you called into an office and the front desk answered the phone, ask, what type of technique does the chiropractor utilize? If the staff isn't aware, then I would be very concerned to the fact that if your staff isn't in tune with what you do and how you help patients, I would be concerned.
Yeah, so I guess the two questions that at least if you want to have similar care as I received and you're providing, would be chiropractic biophysics, or CBP, and Gonstead. So that would be the two keys. And if they haven't heard of it, the staff, then you said, well, okay, thank you, but no thanks. Find
Yeah, and
someone
they make
else.
a very strong structural correction
Right,
program.
right.
That's for sure.
And I just want to say too that, and is it fair to say about 30% of the chiropractors are using this technique? So
I
somewhere in
don't
that,
know. I don't know the numbers,
probably.
but I would say that it's not enough. That's for sure.
Yeah, yeah. So it's certainly not the majority.
Correct.
Now, and I don't want to give the misimpression this is the only way the chiropractic
Right.
is going to work. It isn't. There are the one thing I really admire and respect about the profession is there's so many innovators in there. They've got so many different techniques. But the other primary alternative that seems to work pretty well is network. Developed by Donnie Epstein, and there's maybe just as many people doing network, and totally different approach,
Hmm.
but frequently gets similar results. So, we didn't, I just decided to focus on this, and so there are others, and like you said, there's you just want to avoid a clinician that is not really assiduous and not professional but proficient and consistent in providing it. And one of the other things that impressed me with your office is that you're really pretty well automated. You give all your patients a card, an electronic card that looks like a hotel card, and you could swipe it in, so you'd have to sign. Well, you still have to put your name on the list, and then you bring up the patient medical record, electronic record in your office. So it's very efficient. Your staff is incredible. And I just learned yesterday of I always wondered what was in this one room, but you showed me this is a decompression machine that you also have available that is quite pricey. And the closest one is like, I don't know, an hour and a half away from us, where,
Mm.
to get that therapy. But it's pretty impressive. And, you made the commitment to buy this expensive piece of equipment because there was a woman that you couldn't help who had really severe, I think it was cervical pain, and you
It,
had done, was it hip or
no, it was
cervical?
she had signs of a lumbar
Okay, a
disc
lumbar disc,
lesion.
which is classic because that is the number one cause, what we're going to describe, which is that you couldn't help her for whatever reason. So you, wanting the best for your patient, referred her out to actually a physician, a medical doctor, who prescribed opioid analgesics, that's the conventional standard of care. The clinician probably did nothing wrong, but she wound up dying from the number one cause of death in someone her age group, which was opioid addiction.
Yeah.
And you felt just terrible. So why don't you discuss that a little bit? Because I was impressed with the commitment to care, but then the implementation, how to prevent that from happening in the future.
Well, I know there's limitations to all matter, and that we have to acknowledge that once we get to a point where we've got to do something different, and if it's not in our hands, we got to put it in the hands of someone we would trust. And in her situation, I had previous patients just like her. Other than they responded very well. That had disc bulges, herniations. In her case, she had a very bad disc herniation that migrated, and she had no insurance, and so she was really stuck in this catch-22. She couldn't afford the surgery, and I didn't have spinal decompression, and so I understand quality of life is really important. So she had sought out a doctor, and so I was taking care of her and her boyfriend, and he was downstairs cooking dinner, and she didn't respond. So he had went up there to check on her, and she was at the edge of her bed, kneeling as if she was praying, and she had, I guess, passed away with a heart attack. And I kind of took it on as on a personal note that if I had any chance of avoiding that situation, if I had any part in that, would there have been a tool that I could have helped her with? And that what if is what just took me to that tipping point to know that I had to make an investment in a tool that could have possibly have helped her. And so no different than like the dinners that we do once a month. And I had an existing patient, still a patient, said to me one time, I'm not going to come because I've gone to them many times and I know they're expensive. And I said, Mary, I don't look at the expense. I look at the expense of that child like Liam that had 20-something seizures the week prior to coming in, that the only reason why he came in is because he was invited to one of our community dinners. And if his family didn't understand through the educational component that we provide that we could help him, then he would be continually having seizures. And I had one doctor that was a patient. I was sharing that story with him. He said, well, show me the research. And I said, well, I can actually give you his mom's phone number if you want, because his mom's the one that has to live through those seizures as well as that little boy, Liam. So when it comes to the cost of an equipment or the things that we do in the community, there's no cost when it comes to someone's health and changing lives.
Yeah, so you were able to help with the seizures. I didn't realize that was
Absolutely. Yeah.
one of the other tools that you can use. Typically, I would approach it metabolically with putting them on a very high quality fat diet and getting them brain to burn ketones. But it
Yes.
doesn't mean you can't do it another way and work synergistically by addressing the structural component.
Yeah, I'm a proponent of all of that,
Yeah,
definitely.
yeah. With
Yeah,
your undergraduate degree in nutrition, I would have believed so. So.
sure.
Yeah, and that's the other thing that impressed me, and maybe one that might give you caution as you're seeking to find someone like Dr. Hill, um, is see how they look. I mean, did they look healthy? Now, if you go to Dr. Hill, he and his wife are just health studs. I mean, they really are in phenomenal shape. I mean, they're glowing with health. And this is what happens when you eat the right way and you get regular chiropractic care and you're taking care of yourself. So that's a big clue. If the clinician or the chiropractic clinician you're seeing is like overweight or disheveled, I mean, I'd be cautious about committing to a care under that type of clinician. I
Sure.
mean, would that make sense from your perspective?
Yeah, absolutely. And I appreciate that. Yeah,
You can't be a hypocrite because this stuff, we know this works. There's just no question about it. I mean, clearly it's effective, and because your body wants to stay healthy,
sure.
and if you give it what it needs and stay away from stuff that doesn't, and you address the structural component, which I fully didn't appreciate until later in life, and I have some deep regrets about that, but I'm not going to beat myself up about it because I know
Mm,
my body is really healthy and can prove it. We've seen in 3 months, I've had improvement, and I'm hopeful to get back to the 45 degree and resolve most of that
yeah,
cervical degeneration. So uh,
yeah.
but the
Health
sooner
is a
you start, the
relationship.
better. The
Yeah,
sooner the better.
absolutely. Health is a relationship. You have to constantly work at it. If you don't work on your health, just like any relationship, it'll go south on you. And you touched on something that I like to tell patients is that uh, this mom and son walked up to Gandhi one day and said, and the mother asked Gandhi, "Would you tell my son to stop eating sugar?" You've heard the story, I'm sure of it. And Gandhi said, "You know what? Come back in 2 weeks." So the mom walked with the son through this long processional line and came back up to Gandhi 2 weeks later and said, "Can you tell my son to stop eating sugar?" And Gandhi looked at him and said, "Stop eating sugar." And she said, "Why didn't you tell me that 2 weeks ago?" He said, "Because I had to do the same." And that, when it comes to your doctors, yeah, definitely you want to make sure they're practicing what they preach.
Yeah, that's such an important principle. And this is the first time I've heard about your community dinners. I hadn't encountered that before. So maybe you can expand on that too, because I'm sure a lot of people might be curious.
Yeah, we do community dinners at Stonewoods, which is a nice
Hmm.
restaurant in
One of the
in
nicer
uh,
ones in our community, right?
in our community. Absolutely. And so once a month, we invite our patients to come and bring a guest, and we have hand selected the menu um, to the best choices possible. And so while the dinner is being cooked, there is no obligation. I
Hmm.
actually just talk about health in general and that they can make a decision if they want. And if they trust in us, then obviously we want to be able to be available to them. But the end of the night, it's just a great night of fellowship, a chance to meet people that we normally wouldn't have been able to meet. Otherwise, it's very hard to get out in the community when we're in here in our office serving the community that's coming into it. So it's a great way to extend ourselves out in the community.
Great. Great. It's a
Yeah.
good strategy, and I'm sure it's helped a lot of people being exposed to the work you're doing, and as a result, they've gotten into care and improve their health, which is
Absolutely.
really the focus and the goal of the whole process.
Hmm.
So anything else you'd like to add to this before we close?
No, I just want to say thank you for having me here, and thank you for allowing me to take care of you and Aaron. And I just thank our community for entrusting in my wife and I and our family and our team to be able to help them and help them see how chiropractic can help them and tear down those walls of discrimination. And I'd love to see every doctor, every form of doctor in this office to help them, as I know they've been able to. They saved my dad's life. To do
Yeah,
that 5-way bypass. So, I definitely commend everyone that obviously has been able to take charge of their health, more or
yeah.
less, and trust
Take
us.
charge or take control, as we like to call it.
Absolutely.
So it's putting you in control, but also recognizing that structure does have a significant influence and impact on your health. And if you fail to appreciate that and implement strategies to address that, and certainly home exercises are a phenomenal way to do it, and it works synergistically with a good type of chiropractic care program. So I want to thank you for what you're doing and what you've done for me, and you keep up the good work because you're helping a lot of people.
Thank you, Doc. I really appreciate it.